Hello, good morning. My name is Stuart. I live in Bournemouth in the United Kingdom, and I've just got a new job in the last 4 weeks working for a company called OPTICAL Express, which specialises in laser eye surgery and lens replacement eye surgery. And I'm loving my new job. Today I'm going to drive to Southampton, which is about an hour-long drive, allowing for traffic probably. It's raining today. I'm going to witness some lens. I'm actually going to witness some laser surgery today, some laser eye surgery today. We have two types of laser eye surgery, which is called LASIK, L-A-S-I-K, and LASEK, L-A-S-E-K. Sometimes it's just shortened to I-K and E-K. I-K is a pretty simple operation that's been done for 20 years, and with Optical Express we have a board called the International Medical Advisory Board, and there's a lady on there who did performed the first laser eye surgery. Must be 30 years ago or something now. So it's pretty standard. But IK creates a little flap in the cornea, which is rolled back so that the laser can deal with the prescription. And just a few zaps. It doesn't really take very long at all, and then the flap is put back. And then with the LASEK, a little more intrusive. The front layer of the eye is kind of removed completely, and the laser surgery is done, and then a sort of contact lens type thing is put over the top of the eye to prevent infection and aid healing. The recovery from that is a little bit longer. It might take a few weeks for that to kind of settle down. But the results generally mean no distance glasses. Although that procedure doesn't deal with what we call presbyopia, which is sort of nearsighted problems are caused by age, and so you will need some glasses for that. Sort of happens from the age of 40, 45 onwards, generally to people. And at that point then you need lens replacement surgery. Different types of lenses as well. You can have a monofocal lens, which will deal with your intermediate and longer distance, but that won't correct the presbyopia, the near vision. So the other type of lens, which is a premium lens, is called a multifocal lens, and a bit like varifocals, it deals with near, middle and long distance as well. For very, very small tasks, threading a needle or looking at very small print, you might still need a little pair of reading glasses. But these are some of the things that I've learnt over the last 4 weeks. I'm just coming into my 5th week of working for Optical Express, and I have to say I absolutely love it. My job title is Patient Advisor, which made my wife laugh because she doesn't consider I'm the most patient of people. But my job is very varied, and ideally, once I'm fully up, set and running and signed off from my training, I'll be helping patients with their surgeries right from the moment from when they book in and I ring them up to do an introductory call, right through to seeing them perhaps after surgery. And there is a 3-month window where they can their eyesight may settle down. They might need a further bit of laser treatment or something to get the eyesight as perfect as we can get it. And if any additional surgery is required, that's included in the price that we quote people. Laser is cheaper than lens replacement surgery. Lens replacement surgery starts from about £3,500 per eye. So you can, depending on the prescription, every eye is unique, and every lens is unique as well. And before people are fitted with actual lenses, they have to have some further tests done at our surgery centre. So I'm based in Bournemouth, but we don't have an actual surgery there. We have one in Southampton. Also, the other nearest ones to us are Bristol and Exeter as well. So that's a little insight on what I'm doing when a patient comes in. I look after them. I do a health questionnaire with them, and I help them with doing lots of diagnostic scans using some amazing technical equipment. We have what's called an auto-refract machine, which you will have done if you've had an eye test done. You look at a hot air balloon normally, and that goes in and out of focus and gives the optician a rough idea of what your prescription is. We also do what we call pressures, and a little puffs of air tells us if the pressures in your eye are okay. Anything below 20 is generally fine. Anything over that can be a bit of a concern and might give signs of glaucoma, something like that. And then we do lots of scans. We take photographs of the front of the eye and the back of the eye, the retina right at the back, the macula, which is where the optic, in the centre of the retina, where the optic nerve comes out. We look at the health of the eye and the curvature of the eye as well. If your eye really should be quite spherical, like a football, but sometimes if a person's eye is shaped more like a rugby ball, then that can affect the sight as well. We can see from the tests and from the photographs if anyone's got signs of cataracts. And the lens replacement surgery actually deals with the cataracts. It's the same operation actually. You take out the old lens, you put in a new lens, and once you've got a new lens, then you don't have any problems. You won't have any cataracts in future. So that deals with that completely, which is lovely. We have a machine called a Vision X machine, where we do lots of scans, and it should happen more or less automatically once it's set up. It doesn't always. We do what's called a visual fields test, which some of you will know. You look through at a screen with some dots in the middle, and you click a clicker whenever you see a flash of light, and that says if your visual fields is how that is, and that combined with sort of depth perception test, which is basically put on some special glasses and see what you can see in 3D. That tells us if you're suitable for lens replacement, and if so, what sort of type of lens that you could use there. I'm just hesitating because I'm driving on a road, and I'm behind a couple of what look like massive sheds. They're sort of like mobile homes, I think, which are on the move from somewhere. They've got a wide vehicle escort with them. I've overtaken one and just overtaken the other one. That's why I've just hesitated a second. So the visual fields tests, we find out what your person's dominant eye is, and also say have a look at this 3D book as well, where different objects stand out or not really, hopefully if they do. Take person's blood pressure as well and find out what their dominant eye is. If you want to know what your dominant eye is, then hold your hands out, make a little triangle with a gap and have a look at something in the distance, and then bring your, well, you can close one eye after the other, and the one which you can still see the object with is your dominant eye. Alternatively, or as a double check, you can bring your hands forward, and if you can still see the object, bring it right forward, and then see which eye you've brought it forward to, and that will tell you what your dominant eye is. Then after all those tests are done, we hand the patient over, we do a patient handover to an optometrist. Now the optometrist can actually be in situ in the clinic, or they could be anywhere in the country. We've got an amazing Visionix machine which connects to optometrists working for Optical Express anywhere in the country. So you can speak to someone up in Glasgow or in Ireland, or Bristol. It doesn't really matter where, but they come on and they can actually operate the eyesight machine, the eye testing machine, from where they are. So they will have a look at and sort out the prescription, and after they've looked at all the tests, they will say whether someone is suitable for surgery or not. And if they are, then they give a quote. They say what the surgery is going to cost, and they put then they hand the patient back to me, and I give the patient some surgery dates. If they want to proceed straight away, I'll take a deposit from them and book them in for their surgery. Prior to the surgery, they will have a face-to-face if they want it, or just a telephone conversation with their surgeon. And they probably also need to go to the surgery centre to have some additional scans called. We have an IOL master, that's an interocular lens master machine, which maps the eye down to precise detail, and also a machine which is unique to Optical Express for laser surgery, which is called eye design. And whereas it just gets the prescription down to the minutest detail, really. It costs a little bit extra to do that, but if you're spending money on your eyes, then I think that's worth it. So and then I'll phone the patient up to see how they're doing, answer any questions, and go on from there. Job done. So that's my new job. I thought you might like a little bit of an insight into it. I absolutely love it. There's of course bits of admin to do, emails to respond to, and people to ring all the time, as well as online study. We have what's called the Academy, where there are lots and lots of modules of study, and you can go as deep or as shallow as you like, really, in the study and in your knowledge of the eye. The eye is an amazing thing. Optometrists study for 4 years. It's incredible that there's that much to study in the eye, but there is. And to be an ophthalmic surgeon, and of course we have surgeons doing the actual eye surgery, that I think that's I think it's 13 years you've got to do before you can actually operate the people, all done sort of under a microscope in an amazing surgery situation, which is incredibly hygienic. So I'm going to see that today. I'm going to have to scrub up to wash my hands, obviously, and to put on sort of clean scrubs and Crocs as well, to witness the surgery this morning and go through the process with the patient. So anyway, that's all from me now. If you've got any questions, feel free to ask. If you want to know more about laser eye surgery or lens replacement surgery, feel free to ask. And it's a bit different to what I've done before. Those of you that know me will know that I'm now 63 years old and I'm just starting a new career. But there we are. Just goes to show it's never too late to reinvent yourself. Bye for now.